their vision is on what everybody else thinks about them. And so if you get them in a culture where the culture says, well, you have to be skinny, their thoughts get so obsessive about what they're going to eat, what they're not going to eat, that if you did a pie chart of what they're actually thinking about, they would say that 90% of the time they're thinking about what they're eating or not eating.
G'day, and welcome to Wellbeing. I'm Jack Hodgins. Today we are kicking off our 13-part series on Anorexia Nervosa. Anorexia has the highest fatality rate of any other mental health condition and is characterised by the fear of being overweight. In our first instalment of this series, we are talking with internationally renowned eating disorder expert Dr. Judith Brisman. Dr. Brisman is the co-author of the book Surviving an Eating Disorder, which when it was first released in 1988 was the first book to offer effective advice for families and friends of those going through eating disorders. Dr. Brisman is also a pioneer in the eating disorders field, having founded the Eating Disorder Resource Centre in 1981, which at the time was the first centre of its kind. Dr. Brisman is on the line now to share her knowledge upon anorexia. Hello, Judith, and welcome to Wellbeing.
Thanks, Jack, for having me on.
Many have heard the term anorexia, but what actually is it?
Well, anorexia is when someone willingly stops eating or restricts their eating and loses an extraordinary amount of weight, a lot of weight in a short period of time. And one of the things that I want to say is a couple of things about anorexia. It looks like it's about food, and it looks like it's just about somebody wanting to be thin. But it actually, for the most part, is a psychological disorder that allows people to stop their feelings, to push down feelings, and to sort of form an identity around being a good person who doesn't eat. And the other thing I want to say is that we always think of anorexic as people who are incredibly skinny and that we would notice it right away. But if someone in a large body loses a lot of weight in a short amount of time by purposely restricting, that is potentially a sign of anorexia as well.
What brings it on?
Anorexia starts with a diet, and it just starts with somebody saying they're going to lose a few pounds. But for the person for whom the anorexia kicks in, suddenly it becomes this way of feeling like they're a really good person, and they start to feel like if they lose one more pound, they'll feel even better. And suddenly, as I was saying earlier, it starts to take on this psychological profile in a certain way in which suddenly it's not like a person wants to get down to a certain number. They just have to keep going. They have to keep losing more weight. And that what they're trying to do is to really, it looks like they're trying to lose weight, but they're really trying to form an identity around being the best or eating the least. And suddenly that takes on more of an identity than actually who they are in other arenas. When I talk to my patients who are anorexic, they'll tell me is that the best part of recovery is they're just not thinking about food anymore. That when they start to get into this, their thoughts get so obsessive about what they're going to eat, what they're not going to eat, that if you did a pie chart of what they're actually thinking about, they would say that 90% of the time they're thinking about what they're eating or not eating. So it starts really insidiously, and we actually don't know who will get locked into this restriction and who won't. Mostly what I see is that, first of all, there is a genetic factor to anorexia. So what we're finding is that people who have a history of sort of being perfectionist or a little bit OCD, obsessional compulsive, or whether they were kids who were the kind of kids who had to draw within the line or their shoes were all lined up straight, those are the kids who have a harder time with transition. And so when they get to adolescence or when there's something emotionally difficult in their life, and it could be for adults too, not just kids, they want to get to a place that's perfect. And they want to clean up all the messes that we have to deal with in life. And in our culture, one of the main things that we're told is that actually in Eastern and Western culture at this point is if you're thin, you're good and you're cleaning up the messes. And so what happens is they turn to not eating as a way of trying to deal with other things, other relational and interpersonal issues that are around them.
When does it usually occur? Like, what's the usual onset?
I mean, the usual onset is teen years, but I hate to say it. I mean, we're seeing kids as early as 8. There are hospitals in the state that are filled to capacity for 8 to 10-year-olds at this stage of the game for anorexia. And we're in a really difficult culture that really insists that people be thin. And, that's starting to change. There's a health at every size movement. But when, with the onset of social media, so that young kids are seeing all over the place pictures of people who, that they're, supposed to be smaller, that there's already a diet culture amongst 5-year-olds. Usually it starts in teenage years. And but it also can start at points of transition. So maybe when a kid goes off to college, or maybe when a little bit younger adult is starting a new job or looking for a job. But it usually starts when there's some sort of change in someone's life and emotions that have to be dealt with.
Have you seen a rise in cases, say, since social media came to be more prevalent?
Oh my God, it's so awful. I mean, I speak about Instagram and social media with every single one of my patients because, first of all, there's so many influencers out there who are eating disordered and who are telling the world what other people should eat. And I know some of them have been patients of mine over the years. But I think, there is a movement called Health at Every Size where there's a push for people to be able to appreciate bodies of all sizes. But what happens on social media is young women get on who are tiny and maybe have gained 2 pounds, and they'll show like a little wrinkle in their stomach and say, look, I'm accepting my body. And of course, the message is that for anyone who doesn't have the perfectly thin body, how can they feel if this person online is saying she's accepting her bigger body?
What are some signs that someone does have anorexia?
First of all, you'll see a dramatic weight loss. And if somebody's losing 2 to 3 pounds a week, potentially, I don't even want to put a number on it, but if someone's lost a lot of weight quickly, you really need to question what's going on. You'll see that. And like I say, even if someone's in a larger body, we're now realizing that anorexia really can occur at any size, so that someone in a larger body could lose 20 pounds in a month, and all they will get are accolades for how wonderful they look. But, you'll see people cutting up their food into tiny, tiny bites, or I have patients who won't eat except at certain times, so they might push breakfast till noon, and then they might not let themselves eat anything else until 4 o'clock, that kind of thing. You'll obviously see people not eating at dinners that are family dinners. And also, often where it starts is you'll see foods become good or bad, and so certain foods get excluded. And the problem with our culture, and I know it's the same over in Australia, is that there's a message that if you eat a certain way, you're going to be healthier and stronger. So that could be the keto diet or paleo diet, or you name it. There's innumerable diets. And what happens is it looks like someone's starting out with the quest of being healthy. But what happens is when anorexia sort of kicks in, foods get eliminated, and then more and more foods get eliminated. So, for example, I had a patient who came in a few months ago, and she had lost 30 pounds in a couple months, and she was at a weight that was medically compromised. Her blood pressure was low, her heartbeat was low, she was fainting. And when I asked her what she ate, she was embarrassed to tell me, quote, I'm putting this in quote, how much she ate, because she would eat 3 eggs at breakfast because she'd be starving by the morning, and then she would eat a bag of popcorn, and then she would eat a full bag of chopped carrots, and that was it. And what happens is when patients come into treatment and you try to work with them to start to eat, this is really important for family and friends to know. It's like if you say, come on, you just have this, this is just 1 teaspoon. What's going on in the person's mind is they're saying, I've done all this work to lose this weight, and I'm going to fail. I'm going to screw it up now. Or I've heard patients say that they tell themselves they're a fat pig. Or alternately, when they are starving and sitting at a table with friends or family, they look at everybody else, and even though they're dying to eat in certain ways, they look and they say, yeah, but I'm the thinnest. I look the best. And so you'll see all sorts of rules and restriction around eating and food. And it really has an effect on anyone that's around them. When I hear about eating disorders, I'm thinking about the people that care about someone who has an eating disorder, because it's an infuriating, anorexia is an infuriating disease to witness, because it just doesn't make any sense. We have, fathers and mothers who come in and say, this is crazy. I mean, all she has to eat, we're asking her to eat just like 1, bite of something, and, she won't. And in terms of treatment, there's something called the Maudsley treatment or family-based treatment. And for younger kids or younger teens, this involves parents literally sitting meal by meal, and usually with the support of a support group that's for eating disorders or professionals. They'll literally feed their child one bite at a time until weight is restored. You know, the problem with that, and I get a lot of people who've tried that, and the kids are just stonewalling them and just absolutely not eating. Or if you get an older adolescent or young adult, it's very hard to sit there and feed your kid bite by bite. And also, for many families, just economically, they're not in a position where one of the parents can stay home all day and feed somebody. And I'm the author of a book called Surviving an Eating Disorder, Strategies for Family and Friends, and it's out now in the 4th edition. You can get it on Amazon, I think even over there where you are.
Yep.
And, good, okay. And in Surviving an Eating Disorder, we've written that for the family and friends who are at wit's end about what to do. And we have what we call the relationship model, which is a little bit different than feeding the person you love, spoonful by spoonful. What we do, and this involves, recovery really does involve, it's a lot of work. Either you're going to really dedicate your time to completely taking care of your child, but if you're not in that position, or as I say, with an older child or a son or daughter, what we do is we would have a doctor who's an expert in eating disorders who would know what a goal weight should be for the person. We would have a nutritionist or registered dietitian work with the person to slowly, very slowly, in a way that's not scary for this person, the person struggling with the anorexia, to just start to add what's needed to be plated meal by meal so that weight is slowly gained. And in my role, I'm a psychologist. I would come in to look at what gets in the way. And where parents are a critical part of this, or loved ones, whomever is in the picture as a caretaker, or a spouse. Well, spouse is different. It's a different situation. But in terms of caretakers, I want to work with them as part of the team, because if they're not actually feeding their child, what they're going to need to do is to make sure that the needed food is there and that there's a consequence if the goals that the nutritionist has set can't be met by this person. So, for example, if usually we say that 1 to 2 pounds a week has to be gained slowly, but 1 to 2 pounds for in order to get to the recovery weight. And if the person can't do that, where the parents come in, is we want to have absolutely clear consequences. That this isn't a punishment, but it means the kid's in trouble. And it may mean, first step, that they have to stop playing sports because they're burning too many calories, and they're not allowing themselves to gain the needed pound a week. It may be that they need to go into treatment more aggressively, so that it may mean more times a week, or a partial hospitalization, or ultimately, if the person they care about really can't do it, the message has to be that they're needing the person is needing a higher level of care. And this is where it's really important that parents make that real. Because I have kids who say to me, I don't need to gain the weight. My parents are never going to put me in a residential program. And you know what? They're right. And the kids don't move forward. But when the kids know that the parents have actually called a residential program that has an expertise in eating disorders, that there's a consultation set up, that there's an actual bed, and again, it's not a punishment. It's saying to the kid, look, you're in trouble, and I don't want to look back in a year and feel like I didn't pay attention. And if you can't do it on your own, it means you need some support. So I've had a lot of kids just break down and cry at that point and say it's a relief. A lot of kids will kick and scream. I even want to warn parents of that. But I've also seen kids get right up to the weight that they need to be, just so that they won't go into residential. They'll keep it right at that weight, but it's a consequence that means something to them. It may mean that they're not going on a summer trip or to camp, something that's meaningful to the person, or something that will give them more health.
You're listening to Wellbeing, a nationally distributed radio show and podcast. My guest today is Dr. Judith Brisman, where we are discussing anorexia nervosa. For someone to be diagnosed as anorexic, what's the criteria? Do you need to be a certain BMI or?
I hate to use numbers because, someone may not get down to a certain weight and they could be in an anorexic state, a restrictive state, and they may not have lost 10% of their body weight. But what you want to see is an ongoing weight loss week to week. And you want to, we used to say if with girls, if they lost their menstrual cycle, this was a sign of anorexia, and that can be. But we've also seen kids lose an enormous amount of weight and their menstrual cycles not change. And what you also see is the incredible fear of being fat despite being below a normal BMI.
What is the effect that anorexia has on the physical body, say the internal organs or the heart?
What happens is the body goes into crisis mode. The body basically starts to say, oh, wow, I'm not getting enough fuel to live, so I need to stop using energy. So the heart rate slows, the blood pressure drops, which means this is where you see kids fainting or getting very lightheaded when they stand up. The hormonal system shuts down because certainly in female-identified bodies, that what the body is saying is, like, oh my God, I can't feed and give enough fuel for myself. I certainly can't have another living being in there. So the hormonal system stops. It's really interesting. The whole body slows down so that fuel isn't burned. Calories are fuel, and to make the body live. And I didn't know this until quite recently, but day to day, even our stomach churns day to day. Like even when we're not eating, it just keeps churning. And if someone gets into a really severe anorexic state, their stomach actually will slow down and stop churning, which means that what happens is if they start to eat something, it doesn't get digested. They have intense stomach pain, and so when someone's in that place, they actually really need medical care. And sometimes, it's funny because, Jack, what we're seeing often these days is not just one diagnosis. Like we're seeing a melange of symptoms. So we may get someone who's anorexic. I had a patient who certainly was restricting, but she also was a laxative abuser, and this was her way of purging. And it's really important. Laxatives, if anyone out there taking laxatives, pay attention because they're addictive. By the time this person came in to see me, she was taking 100 X-Lax a day. And what happens when you start to use X-Lax or laxatives to control your bowel movements, what happens is you lose your water weight, so your stomach feels flat. So my patient felt very thin every time she took them, but your body gets inured to it. And so you have to take one and two, and it can get up to 100 before they actually work. But when they do work, at that stage of the game, it's messy. I mean, it's unpredictable when you're going to go to the bathroom. There are accidents. And again, you need medical care to go off of the laxatives because if you just abruptly stop, your body actually won't function right away. And of course, that can create incredible pain and bloating. So what we do is we work with doctors to slow down, titrate the use of laxatives, and then finally putting the very milder laxatives until the body kicks in itself. But there's just innumerable physical symptoms of it. But what my patients talk about and what I see when patients first come to me with anorexia is they're like a walking ghost. I mean, they look ashen, their eyes are sunken, but they'll say they don't, when they get into recovery, they'll say, I don't remember anything around that time. Because it's funny. I mean, in the worst cases of anorexia, when the body has no fuel, no calories at all to go on, the body actually can start to eat away at muscle. It certainly eats the fat to get calories and fuel. But then it eats muscle, and it can also start to eat at the brain. So, but even when the brain is not fueled, even in the first few days of restriction, someone's not thinking clearly. So, in addition to the physical signs, what I just see are people don't, their memory's bad, their concentration is bad, and they're disconnected. They have a really hard time making connections. And part of treatment, by the way, it's really important. It's not just helping someone gain weight. That certainly is the first step. I mean, we have to get someone to a medically stable place. But the other part is, who is this person? How do we get to know this person? And when I use the word connection, one of the things that's most valuable in treatment, if any of your listeners are looking for treatment or someone they love needs treatment, they need to be with someone who really wants to connect with them, who wants to get to know who they are underneath the restriction. What feelings do they have? I mean, often what happens, a patient of mine said this well the other day. She said, great, now I'm at a normal weight. And she is. She looks great. She's healthy. She's eating well. She says, yeah, now I have to feel all these feelings. And she can get anxious and she can get depressed and she gets angry. But she will say, but you know what? I'm alive. And I'm really feeling things now. And now I have a possibility of dealing with the things that are making me angry. When you're in a skeletal shell of yourself, and not eating is your only solution. You don't have a solution to solve the things that you might be upset about, or that you might feel disconnected from.
Can anorexia affect the genders differently?
It's a great question because, we used to see this as a white, privileged, young girl disease. And only recently are we realizing that we have really missed where anorexia is in the diverse culture and amongst boys. In fact, I just read a study recently. This is really interesting. If boys are, when they're younger, they're chubby or considered big, they are more likely to become anorexic than they have a high likelihood of becoming anorexic, higher than a boy in a normal-sized body. And we're seeing many more boys develop anorexia, and we're also seeing we realize we totally missed the world of gender fluidity. Of course, this is all a new subject, and we're learning so much about this. But think about it: if you're in a male body and you believe you're a woman, and you're 13 years old or 15 years old, and you're wanting to feel like you really, you want to look like you really believe you are, the first thing you're going to do is try to make your body smaller. And so we're also seeing anorexia in the transgender community, and we're seeing it also because there's just a ton of bullying, whatever gender somebody is, if there's any sort of fluidity. So yes, we are seeing an increasing number of people of all genders developing eating disorders and anorexia. But the other thing I want to say is anorexics don't come into treatment. They don't do it alone. So in the book Surviving an Eating Disorder, one of the things we wanted to say to family and friends is if you're concerned, say something. Because parents and friends come to us all the time and say, look, we don't want to embarrass them. We don't, or parents might say, listen, she's a straight A student, my daughter, and she's doing really great. And, I don't want to make a big problem out of this. But the important thing to know is that even though someone may be looking like they're succeeding really well in life or doing really well, if they're losing weight, if you're concerned about how they're eating, it's really important to let them know you're concerned, because if indeed there is a problem, you don't want to look back in a year or two and think, oh my God, I never even said anything. And so in our book, we literally have a chapter of what you can do, what you can say, how you can comfortably have a conversation with someone if you're concerned about them. And we also say to family and friends, don't go it alone. There's an international support group called FEAST for family and friends that are for anyone who's concerned about someone who has an eating disorder. They can be of help, or providers who have expertise in eating disorders. It's really hard because what's going to happen is someone who's struggling with anorexia won't feel they're struggling. And so if you say to them you're having a hard time, almost all the time they're going to say you're the one having a hard time. You diet all the time. You're worried about your looks and how big you are. You're going to get a fight. And so it's really important to find out what you need to do when you speak to someone who says they don't have a problem, and you can see that they're in trouble. And the thing to guide you is to say, you know what, they really are in trouble, and you don't want to look back and feel like you missed them. And if there's any question, you bring someone who has a specialty in eating disorders, and tell the person you care about, look, I may be wrong, but I don't want them to miss you, because if someone is struggling with an eating disorder, they really are struggling underneath. They are tortured, and also, actually, this is really important to know, but the earlier the intervention, all the statistics show that the more likely of full recovery there is. I mean, this is a crazy disorder. I mean, it's a really severe disorder, and 1/3 of people don't recover. I mean, they spend their lives in and out of hospitals and really struggling with the anorexia. And 1/3 of the population of people who've had anorexia, they get better, but on and off through their life, they have rigid eating or disordered eating. 1/3 of people really, really can recover, and it's really important to know that that is a possibility, particularly if you help intervene early. But someone who is anorexic, it's almost impossible that they decide that they need to get treatment themselves.
You're listening to Wellbeing, a nationally distributed radio show and podcast. My guest today is Dr. Judith Brisman, where we are discussing Anorexia Nervosa. Would you say, Judith, that there's a lot of stigma in society towards anorexia?
What's sad is that, so many models have been anorexic that I think the stigma is just beginning, that, this is not okay when you see someone in the street that's that thin, that there might be a bit of a stigma that's developing. The unfortunate stigma in our cultures is that if you're in a large body, that if you're full, something's wrong with you, you're a failure. And this has been a real problem because there's all sorts of research that someone in a large body is going to develop medical issues more than someone in a smaller body. But part of the problem there is that someone in a large body doesn't go to the doctor because they're ashamed of being on a scale. Or that the first thing the doctor will say if they have high blood pressure, the doctor won't say, gee, is there a history of high blood pressure in your family? The first thing the doctor will say is, listen, you have to lose weight. So the stigma still, I think, is with larger bodies, not smaller bodies. But I think there's enough information that if someone is really beginning to lose weight, people are paying attention and knowing that something needs to be done.
Can anorexia cause delayed puberty or infertility?
It's interesting. If someone doesn't recover from anorexia, absolutely, because as I was saying before, the hormones will stop. And if someone develops anorexia before they started their menstrual cycle, absolutely it will delay puberty. And also a really important factor is it impedes bone growth. And so when someone is, 10 to, through adolescence, their bones are developing density. And if they start to starve at that point or start to restrict, they actually pretty quickly can lose the bone density that's supposed to grow. And if the restriction goes on too long, they actually won't redevelop the bone density, and so that they'll develop either osteopenia or osteoporosis, for which they'll have to be treated ongoing over time. However, if someone comes into treatment and gets into recovery, and only has been restricting for months or a year, it's very likely that the bone density will grow back. But that's actually a really critical thing that happens around puberty as well, in terms of bone growth.
What parts of the brain does it affect?
Well, it certainly affects everything. I mean, it certainly affects concentration, it affects organizational skills, it affects memory. I mean, my patients talk about being in a fog, and their grades can go down, or if their grades stay up, because, if someone's a perfectionist and they're in school, they may be a straight A student. And as we know, perfectionism is linked to anorexia. But the incredible amount of extra work that they will have to do to keep their grades up is they'll say retrospectively, was just incredibly hard. So, in all ways, I'm not being very specific about the brain, but, what I hear is about memory, concentration, organization, and just the fog that they walk around in.
Can it change the brain over time as it gets worse?
I think certainly in the chronic stages of chronic cases of anorexia, there's no question that the brain gets impaired and stays impaired with the kinds of cognitive functioning that I'm talking about. But if someone is in treatment and not a prolonged years and years long, we as I know, if someone is in recovery from anorexia, their brain is able to repair itself. But it reminds me of what happened with autism years ago. And years ago, the parents, we thought that autism was the result of poor parenting. We thought that schizophrenia was from schizophrenic mothers, we would call them, really poor parenting. And, we were humbled over time to realize that schizophrenia and autism have are completely physiologically determined. And I think that, all anorexia, there's a gene for that kind of behavior. I think in the most severe cases, this really is a genetic disorder that only over time we're going to see what this really is. Very much like autism, we won't be saying this is just a psychological disorder. But for many of the patients that come in, they've lost their voice. They don't have a sense of who they are. And I really want to emphasize this because I think we're talking about different kinds of populations. For the patients that I tend to work with who are able to work outpatient, they're really kids who have learned to pay attention to the rest of the world. What do their parents think? What do their classmates think? Are they the best students? And so their vision is on what everybody else thinks about them. And so if you get them in a culture where the culture says, well, you have to be skinny, then that anorexic gene and perfectionism will lock into, oh, God, and I have to be thinner and thinner as well. But what happens when you start to work with them, they don't have any sense of how they feel about themselves. They don't even know if they're hungry. So starting with the food, it becomes a way of saying, what do you feel? What does your body feel? Are you hungry? Are you tired? Does this amount of food make you full? Maybe it doesn't make you full. Maybe you need to eat more. And so the point of treatment is very much, for most of the population, is as physical as it is psychological. Because what we're trying to do is get these kids a voice. Like, what do you think? What do you feel? And I caution families if someone is in recovery, what happens is it's sort of like a Helen Keller experience for these kids. They're like, oh my God, I'm mad at my parents, or I don't like this, or I don't like that. And the parents will say, oh my God, what'd you do to my perfect kid? My kid never complained. She always did the chores. And so what happens is kids hopefully become a normal teenager. Normal teenagers are complicated. Yeah. But what's really important is that we're trying to help someone find a voice about what they feel, because someone who's anorexic is someone who's going to look to the culture and look to other people to say who they should be. They don't have a voice of their own about who they should be. So recovery can be tricky in terms of people around them.
How long does it usually take to recover?
Well, that is such a hard question. Always the question people, parents ask. And I can't tell you how much variation I've seen. I had a kid come in, and her parents were very involved with her in a very positive way. They made it clear that they were going to sit with her with meals, although she did have a physician and she had a nutritionist, and she was seeing me, and she's 15 years old. And she was like 5'5" and 90 pounds. So she was, she should have been in a hospital, but her parents were so clear that she needed to eat, that this is a kid who was able to systematically gain 2 pounds a week for 2 months on end. And so she got to a weight that leveled her off, that she wasn't in medical danger. And that happened in just a few months. And it's a few months, hence she's, her weight has continued to go up a little bit, stabilized, and now she's at a point to decide whether she wants to look at herself further. She's deciding about that. So that was a case where it was just several months that the parents were involved and had a great treatment team, and the kid was motivated because the parents were very, very clear that the whole family was going to cancel their Christmas vacation, that they were going to stay home, that she was going to go to a residential program if she couldn't do it, not as a punishment, but because they were serious about, oh my God, she's really in trouble. Unfortunately, for a lot of people who are struggling with anorexia, it can take some time. And we've seen people go into residential programs because they can't do it outpatient after several months, come out and tumble, and 6 months later they're back in another program. But I have seen those kids and young adults at a certain point say, all right, that's it, I'm not going back. And something about having been in 2 residential programs, maybe it's something as concrete as that, gives them the motivation that they're just not going to let themselves go back to that date. And they're able to then move forward. But that might take a year or two. So, and of course, there are other cases that take longer and cases that take shorter. It really depends on how it depends on how troubled the kid is with anorexia. But it's also important to know that kids can come into the disorder in a really troubled place to begin with. They may have had a really rough childhood. They may have had a history of trauma. The trauma studies are all over the map in terms of what percentage of anorexics have a history of trauma. It goes from something like 20% to 90%. But if someone has had a history of trauma, whether it's a severe one-time attack kind of thing or ongoing low-grade trauma where they just have been missed by their parents ongoing, it's possible that they're going to hold on to the disorder, to the restricting as their lifeline, and that may take a much longer time in terms of treatment. There's a colleague of mine, Anita Johnson, who's out in California, and Anita talks about recovery, and she says, okay, you have this anorexic kid holding on to a log in the midst of a rushing water, a rushing river, and the river's rolling down, and everyone on the side is saying, oh, let go of the log and swim to the side. And the anorexic kid holding on to the log is like, are you out of your mind? There's nothing to hold on to. I'm going to be totally swept away. And that is what an anorexic feels like, someone who is struggling with anorexia, what they feel like when they're in the midst of it. Like, if they let go, they're going to be completely out of control, not just with weight. They believe that they're going to gain all sorts of weight, but emotionally, and they just don't have a sense of their own identity. And so recovery becomes giving them one log after another to hold on to so that they can get to the side of the river. And the logs become either a connection to a person or a therapist, or the log can be a reminder of who they are that they hold on to. I've had some patients where they remember that they like to write or they write poetry. And so remembering that creative part that has died while they're just thinking about food, that becomes a log to hold on to. And then another log might be that they don't want to go into residential and miss summer camp. They loved summer camp, but they might be in residential all summer, so they hold on to that to give them strength. But we want to find building blocks to get them across that rushing river. And it's important, if you know anyone who's anorexic, it's a maddening disease. It looks crazy that they're doing it, but if you think of them holding on to a log for dear life and the water's just racing around them, you might have some idea of how they're feeling.
From all we've talked about, Judith, what would be the take-home from this interview that you'd want people to remember the most?
I think a couple things. I'd want, even though it looks like anorexia is a disorder about food and weight, and it is, to also remember that it's a psychological disorder for the most part, for most people, and that the most important thing is to try to find who that person is separate from the food and weight. And even with someone in the most chronic condition, if we sometimes see people who they're 50 years old, they've been anorexic for 30 years, 40 years, 50 years almost. We're probably not going to get them to gain weight. But what we want to do is find out who the person is and anything that you can connect to about who the person is. You know, when I wrote Surviving an Eating Disorder, I wrote it with two colleagues, and one was my best friend, Michelle Siegel. And Michelle died tragically at 39 of cancer. And when she was dying, I remember her saying, you know, Judith, everyone's talking to me like I'm a cancer patient. I'm still me. And that message, because she wrote the book with me in Surviving, that message of wait, try to find out who your son, daughter, your loved one is, in addition to that they're just struggling with food and weight. That would be a message. How do you connect with them? How have you started to see them just as an anorexic as opposed to someone struggling who has much more to whom they are?
Well, thank you for taking the time to be on the show today, Judith.
Thank you so much. And you're doing such a good thing because, as I'm saying, people out there are really in trouble right now.
My guest today was Dr. Judith Brisman, an internationally renowned eating disorder expert. Tune in next week where we continue looking into anorexia, where we speak with an expert from the University of Melbourne. And if you like this content, check out the Wellbeing podcast for more. Thank you for listening. I'm Jack Hodgins, and all of us at Wellbeing wish you well.